Welcome to a demonstration of Group K's diagnostic system. Today, we'll be meeting with Dr. Steve, Nurse John, and patient Jane. Jane has come in for her quarterly check on her liver, as she has fatty liver disease. Nurse John is going to take her height and weight, but he no longer has to use the bulky equipment and needles for the typical blood draw. He pulls out a phone and uses his unique login to log into Group K's app. The very first button John will hit is the Start Test button. This allows him to commence filling an order he's pulled from the EHR, or Electronic Health Record. He also pulls the device out of special packaging and immediately scans the QR code in the upper left corner. This tells him that the device has not expired and confirms that it is for liver function testing, which is what the doctor ordered. John then asks Jane for her name and date of birth and checks for her patient record number so he can associate the device with Jane and only Jane. To complete the linking process, John is now prompted to scan a barcode on the right side of the device. Now Jane's test cannot be confused or lost or mistaken for another patient's results. After pricking her finger and completing the test, John finishes discussing Jane's new symptoms with her and lets her know that the doctor will be in shortly. About 20 minutes later, Dr. Steve walks in, and as he walks in, a timer goes off on the app, letting him know that Jane's results are ready. Dr. Steve opens the app and clicks the second button, Get Results. The first thing Dr. Steve does is scan the patient barcode to confirm that this is actually Jane's test. Her name and date of birth appear, and he confirms that she is in fact Jane Doe. Next, he takes pictures of both panels of the device, and the computer algorithm adjusts for lighting, focus, and also ensures that there is sufficient blood on the device. In a few seconds, results are up. Dr. Steve is able to immediately give Jane her results and change her treatment plan. She doesn't have to go to any additional appointments at the clinic or at an additional lab. And that's all there is to it. If you'd like to learn more about Group K's process, click here or go to www.groupkdiagnostics.com.